Hello and welcome. According to the nation's leading neurologists, the doctors who dedicate their lives to the human brain, there is a category of stroke that often presents with none of those classic alarms. These are the strokes that occur quietly, the ones whose symptoms are so subtle, so easily dismissed as a normal part of aging that they are ignored by millions of Americans over the age of 65 every single year. I understand that the thought of a stroke happening without your knowledge can be deeply unsettling. It can create a sense of worry, a feeling that your own body might betray you without warning. But what I want you to remember is that knowledge is power. Over the next 30 minutes, I am going to share with you the insights of these top neurological experts. We will pull back the curtain on the 4 silent signs of a stroke that most people ignore. This is not about fear. This is about giving you the clarity and the confidence to protect your health and the health of those you love. This is the information that can make all the difference. Before we can understand the silent signs, we must first dismantle a dangerous and widespread misconception. It's a term you've likely heard, and perhaps even used: the mini-stroke. When people say mini-stroke, they are almost always referring to something called a transient ischemic attack, or TIA. A TIA happens when a blood clot temporarily blocks an artery, causing stroke-like symptoms that then disappear, usually within minutes or hours. Because the symptoms resolve, many people believe a TIA is a minor event, a bullet dodged. But one of the most respected stroke specialists in the country describes this belief as one of the most hazardous misunderstandings in all of medicine. A TIA is not a mini-stroke. It is a massive warning sign. It is your body's emergency broadcast system screaming that a major permanent stroke could be imminent, often within hours or days. A TIA causes no permanent brain damage, but it's a profound predictor of one that will. In the world of health, there are few events as feared as a stroke, and for good reason. Most of us have been taught to look for the classic signs, the ones we remember with the acronym FAST: face drooping, arm weakness, speech difficulty, time to call 911. A silent stroke, on the other hand, is completely different. A silent stroke is a true stroke. It occurs when blood flow is cut off and brain cells die. The damage is permanent. The only reason it's called silent is because it strikes a part of the brain that doesn't control a highly visible function, like speaking or moving an arm. So, you don't feel it, you don't see it, but the damage is done. And I know it can be unsettling to learn that such a common piece of advice, the idea of a harmless mini-stroke, is so wrong. It can feel like the ground is shifting beneath your feet. But this clarity is the first step toward true protection. Reassurance comes from understanding the reality of the situation, not from comforting myths. Let me share an anonymized case study from a leading neurologist's clinical files, which illustrates this perfectly. An 82-year-old woman living independently suddenly began having trouble with her balance. She wasn't falling, but she felt unsteady and had to hold on to furniture to walk around her own home. She also became uncharacteristically irritable. Her family attributed it to her age, perhaps a mild urinary tract infection, which can cause confusion in the elderly. They waited a week to see her doctor. When an MRI was finally done, it showed not one, but multiple small old strokes in the areas of her brain that govern coordination and emotional regulation. These were silent strokes. The damage was cumulative, and by the time the symptoms became noticeable, they were irreversible. This story is not unique. In fact, it's a lesson that emergency room physicians and neurologists see constantly. They perform an MRI or CT scan for an unrelated reason, perhaps a fall or a headache, and discover that the patient has evidence of one or even multiple silent strokes they never knew they had. Studies show that about 1 in 4 people over the age of 80 have had at least one silent stroke. The damage builds up like small cracks in a foundation until one day the whole structure is compromised. This can lead to the gradual onset of memory problems, difficulty walking, and what is known as vascular dementia. So let's be perfectly clear. A TIA is a warning. A silent stroke is damage, and the 4 signs we're about to discuss are the body's subtle whispers that this damage may be happening. Now that we understand the critical difference between a warning and actual damage, let's turn to the first 2 silent signs. These are often the most frequently misattributed signs of all. The first silent sign is a sudden change in cognitive function, mood, or personality. This is not the gradual memory loss that can sometimes accompany aging. This is abrupt. It can manifest as a sudden bout of confusion or disorientation, getting lost in a familiar place. It might look like a sudden inability to concentrate or make decisions. Or it can be an emotional shift, a rapid change in mood, a sudden burst of apathy where someone loses interest in everything. Or even inappropriate emotional responses, like laughing at sad news. The second silent sign is sudden dizziness, loss of balance, or coordination. This isn't the lightheadedness you might feel from standing up too quickly. This is a true sense of imbalance, a feeling of being unsteady on your feet, or a sensation that the room is spinning, known as vertigo. It might cause you to stumble or grab for support. So how do we act on this knowledge? The most powerful strategy recommended by neurologists for preventing these events is not a new pill or a complex procedure. It is the diligent, uncompromising management of your blood pressure. High blood pressure, or hypertension, is described by experts from the National Institute of Neurological Disorders and Stroke as by far the most potent risk factor for stroke. It is the relentless, silent force that damages the delicate lining of the arteries leading to your brain, making them prone to clots and rupture. The how-to here is simple in concept, but requires consistency. First, know your numbers. Work with your doctor to establish a target blood pressure. Second, if medication is prescribed, take it exactly as directed, without fail. And this is where we see a very common mistake. Many people will stop taking their medication once their blood pressure returns to a normal range, thinking the problem is solved. But a leading cardiologist explains that this is like firing your security guard, because there haven't been any break-ins. The medication is the security guard. It's what's keeping the pressure down. Consistency is everything. For those who are just beginning to manage their blood pressure, or for whom medication alone isn't enough, the expert advice is to focus on lifestyle. This includes gentle, regular movement, like a brisk 30-minute walk most days of the week, and dietary changes, specifically reducing your sodium intake. I understand that starting a new health regimen can feel like a mountain to climb, but please, do not feel overwhelmed. The goal is not perfection overnight. It's about taking one small, sustainable step. Perhaps it's choosing the low-sodium soup at the grocery store, or taking a 10-minute walk after dinner. Each small choice is a deposit into the bank account of your long-term brain health. You can do this. Let's move to our next 2 silent signs. These are less about cognitive state and more about our physical senses, and they require us to become careful observers of sudden changes in our body. The third silent sign is a sudden problem with vision in one or both eyes. This is not about the gradual need for stronger reading glasses. This is an acute event. It could be sudden blurred vision, double vision, or even a complete loss of vision in one eye. One of the most specific and often overlooked visual signs of a stroke is what's called a visual field cut. A neurologist with over 30 years of experience describes it this way. A patient might report that they can't see out of their left eye, but when tested, they're actually missing the left half of the visual world from both eyes. They might start bumping into things on one side, or only shave one side of their face, completely unaware of the deficit. The fourth silent sign is the most traumatic, yet it is still often misunderstood. It is a sudden, severe headache with no known cause. This is not a typical tension headache or even a migraine for those who suffer from them. This is often described by patients and doctors as a thunderclap headache. It is a jolt of pain that is explosive and reaches its maximum intensity in under a minute. It is frequently a sign of a hemorrhagic stroke, where a blood vessel has actually burst in the brain. Now, a common question that arises here is, how can I possibly tell the difference between a stroke symptom and a normal ache, pain, or sign of aging? I get dizzy sometimes. My vision isn't perfect. I get headaches. And it's a perfectly valid question. The answer, which neurologists repeat like a mantra, lies in one single word: sudden. Was the onset sudden? Did this dizziness appear out of nowhere, not related to standing up too fast? Did this vision problem happen in an instant? Did this headache explode into being? Chronic conditions develop over time. The effects of aging are gradual. But a stroke is an acute event. The blood supply is interrupted now. The brain is in crisis now. That suddenness is the single most important clue your body can give you. I want to acknowledge that it is very easy to second-guess yourself in these moments. We are conditioned to not want to be a bother, to not overreact, to not rush to the emergency room for what might be nothing. This is a common point of failure, and it's a deeply human one. But when it comes to the brain, the experts are unanimous. It is always, without exception, better to be safe than sorry. It is better to have a doctor tell you it was nothing than to have a loved one wish you had acted sooner. Let's pause here for a moment and take a breath. We have covered a great deal of critical information. We started by dismantling the myth of the mini-stroke, understanding that a TIA is a dire warning, and a silent stroke is real, permanent damage. We then identified the 4 most commonly ignored signs of that damage: sudden changes in cognition or mood. They are simply different expressions of the same underlying crisis, a disruption of blood flow to a specific part of the brain. A stroke in the cerebellum might cause dizziness. A stroke in the occipital lobe might cause vision loss. A stroke in the frontal lobe could cause a personality change. They are all distress signals from different neighborhoods of the same city. And I want to commend you for your attention. This is not simple material. By taking the time to understand these nuances, you are taking a profound step toward protecting yourself and your family. You are building a new awareness. But knowing the signs is only half the battle. To truly grasp why every second matters, we need to go deeper. We need to understand what is happening inside the brain on a cellular level from the moment a stroke begins. The signs tell you that a fire has started. What we're about to discuss is why the fire department needs to be called immediately. The stakes are about to get much higher. To understand why time is so critical in a stroke, we need to visit the scene of the crime. We need to understand a concept that neurologists call the ischemic penumbra. Imagine a territory in the brain where a blood vessel has been blocked. At the very center of this territory is what doctors call the infarct core. Here, The loss of blood flow is so severe, so absolute, that the brain cells begin to die within minutes. This damage is irreversible. This is the tragic, unavoidable consequence of the blockage. But surrounding this dead zone is a larger area of tissue. This is the penumbra. Think of it as a gray zone, a battlefield where a desperate struggle for survival is taking place. The brain cells in the penumbra are not dead, but they're starving. They have lost enough blood flow to stop functioning. They are electrically silent, but they are still metabolically alive. They are in a state of suspended animation, waiting. They are waiting for one of two things: either the restoration of blood flow, which will allow them to recover and come back online, or the continued lack of oxygen, which will cause them to succumb and join the infarct core, expanding the area of permanent damage. Every single minute that passes without treatment, this core of dead tissue grows, consuming the salvageable penumbra around it. The popular phrase, "time is brain," is not just a slogan. This is why you call 911. This is why you don't wait to see if symptoms improve. The goal of emergency stroke treatment, like the clot-busting drug known as TPA, is not to revive the dead core. The goal is to restore blood flow to the penumbra, to save the tissue that is at risk. Now, after explaining this process, a very practical question neurologists often hear is, if I get treatment in time, what should I expect to see? The answer is that the initial benefits can be small but significant. If treatment is successful and the penumbra is saved, you might notice a gradual return of some function that was lost. The weakness in a limb might lessen. The confusion might begin to clear. The recovery process is a marathon, not a sprint. But those first small signs of improvement are often the direct result of having saved that precious, vulnerable brain tissue. It is a testament to the power of acting fast. We have covered the signs to watch for and the science of why we must act quickly. Now, as we approach the end of our time together, I want to close the loop and offer you one single unifying principle that makes all of this simpler. We've talked about blood pressure, cholesterol, diabetes, and lifestyle changes. It can feel like a long and complicated checklist. But according to the experts who have dedicated their careers to this, all of stroke prevention can be distilled into one core idea, one powerful mission: protect the pathways. Think of your brain as a complex and brilliant city. For that city to thrive, it needs power. It needs supplies. It needs oxygen. All of these are delivered through a vast network of highways and roads, your blood vessels. An ischemic stroke is a roadblock on one of those highways. A hemorrhagic stroke is a burst water main that floods a neighborhood. When you see it this way, everything else falls into place. What does high blood pressure do? It damages the surface of those roads, making them rough and prone to blockages. What does high cholesterol do? It's like dumping sludge and debris onto those roads, narrowing the lanes and causing traffic jams. What does smoking do? It makes the traffic itself, your blood, thicker, stickier, and more likely to clot. When you adopt the mindset of protecting the pathways, your daily choices are no longer a list of disconnected rules. They become part of a single, coherent purpose. Eating a heart-healthy diet isn't about deprivation. This single principle transforms prevention from a burden into an act of stewardship for your own brain. It is the most powerful tool you have, because when your pathways are clear, wide, and healthy, the risk of a catastrophic roadblock plummets. This is the foundation of a long, healthy, and vibrant life. So where do we go from here? How do we translate this knowledge into action without feeling overwhelmed? Let's summarize this into a simple clinical action plan. 3 things to discuss with your doctor at your next visit. First, know your numbers. Ask your doctor, what are my blood pressure, cholesterol, and blood sugar numbers? And what should my personal goals be? Write them down. Track them. This is the dashboard for your brain's health. Second, move your body. Talk with your doctor about a safe and sustainable level of physical activity for you. It doesn't have to be a marathon. The American Heart Association recommends 150 minutes of moderate intensity exercise a week. That's just over 20 minutes a day. A simple, brisk walk is one of the most effective forms of exercise there is. Third, nourish your pathways. Ask your doctor if a Mediterranean or DASH-style eating plan is right for you. These are not restrictive diets. Please hear this clearly. This journey is not about perfection. It is about gentle, consistent effort. It is about progress, not purity. If you have a day where you eat something you shouldn't, or you miss a walk, do not despair. Show yourself the same compassion you would show a dear friend. Tomorrow is a new day to make one small choice to protect your pathways. You are not alone in this. Millions of people are on this same journey, and every small step forward is a victory. Thank you. Thank you for your time and for your commitment to understanding this vital topic. It is a privilege to share this information with you. The wisdom we gain from medical science is invaluable, but so is the wisdom we gain from each other's lived experiences. In that spirit, I would like to invite you to contribute to our community's knowledge. Please, go to the comments section and share your story. Have you ever dismissed a symptom for yourself or a loved one that in hindsight you wish you had paid more attention to? Your experience, shared with courage and honesty, could be the very thing that helps another person in this community recognize a sign they might otherwise ignore. Your story matters. If you found this information valuable, please press the like button, share this video with the people you care about, and subscribe to the channel for more expert-driven health content designed to empower you. Stay well and be kind to yourself.